Remember during COVID when there were people pushing hydroxychloroquine as a treatment for COVID? Remember hydroxychloroquine as a treatment that is for malaria and other conditions. And there was some early studies that suggested that hydroxychloroquine could possibly treat COVID, or rather did treat COVID. One thing I need to say, I very well remember this time. It was a very stressful time in COVID because we didn't have a lot that treated it. But physicians, we realized very early on that hydroxychloroquine was not a treatment for COVID. But let me tell you, there was a study that was published in 2020 in the International Journal of Antimicrobial Agents that claimed that hydroxychloroquine, which again is used for malaria and other things, reduced virus levels in COVID patients and was more effective if used alongside azithromycin, which is an antibiotic. This was a paper that became very popular, popularized hydroxychloroquine as a possible treatment for COVID-19. It was huge. Remember that? There are still people who say hydroxychloroquine treats COVID. It doesn't, okay? We know this. But this paper sort of took things off. This is a really, really important news article that I did not want to be missed because that journal has retracted this study. First of all, retractions, a journal retracting a study means that they're saying it's not good. Take this out. Do not listen to this. There are problems with this. There are problems with the data. Retractions in journals are very rare. And it was retracted due to ethical and methodological issues with the study. What that means is this was no good, which we doctors recognized, okay? And doctors were pushing back against hydroxychloroquine early on. But I'm really glad to see that this study was retracted because it did send a lot of people, this and others, it's not just this, but send a lot of people down a rabbit hole of looking at hydroxychloroquine for COVID and thus likely taking us away from things that did work. I wanted to bring this to your attention, let you know. Just Google it. You can read more details about the retraction. There's also information about one of the co-authors of the study and some issues he's had. Take a look at it for yourself.